engagement of people who have serious mental health conditions into the research that affects the practice and the evidence and the treatment that goes on is probably the only way to be successful. They are the experts.
You talk to people who have lived mental health conditions themselves and are in recovery from mental illness. They have a different perspective on what they need from services. When they're directly partnering to do the research, I feel like it just shifts every phase of what we want to know, how we learn about it, and then how we get that information out to the public.
The Systems and Psychosocial Advances Research Center, which is better known as SPARC, is housed within the Department of Psychiatry at the University of Massachusetts Medical School. Our focus is entirely on psychosocial interventions and policies that impact individuals with mental health conditions. That very much shapes who we are and what we do. So the work is done in partnership with individuals with lived experience.
A lot of people do research where they interview people with lived mental health experience as research participants. What we're really emphasizing is that it's really about partnering in the research, so really thinking about what are the right questions we should be asking, how to recruit individuals for research studies, and really importantly in analyzing data, helping us to figure out what the data mean, and then I think what really sets us apart in disseminating that information.
The research that we do in SPARC largely is aimed at having an impact on populations that are served by public agencies. So for example, in our very long-standing partnership with the Massachusetts Department of Mental Health.
The pragmatic, hands-on, practice-based evidence that have really come out of our relationship with SPARC and our contract with SPARC have enabled us to move light years in the treatment, particularly of young adults with serious mental health conditions. We began looking at aggregating individuals in age cohorts. We began to hire treatment specialists and care coordinators and case managers who would work with young adults. It's really through the efforts of SPARC that we know what works, we know where we need to go, and we know what the continued treatment needs to look like.
When we partner with government with the research that we do, we are able to target it much more accurately to essentially maybe existing policies that they have or to funding streams that they are able to work with to fund a particular intervention. We know that when we do it in partnership with them, that it then is a product that they can use and it then has more impact.
The statewide Youth Advisory Council was created by the Massachusetts Department of Mental Health, and the goal was to really improve services within the Department of Mental Health for young adults who are accessing those services. And they bring together a variety of young people who are either working in the field as peer workers, who are just naturally going through their own recovery. They've definitely spoken out and are very loud when they need to be and are brutally honest, which I think makes the work 10 times better because we're really hearing the honest opinion of those people who have lived those experiences. When I first tried to access resources as a young adult, there was nothing available that I really found helpful. People really didn't engage with young adults. A lot of the information that's being shared about recovery and mental health and school and work for young people isn't created in a format that young people actually want to engage in. So Comeback TV is our national YouTube show about topics that are important to young adults, like how to keep a job, how to find employment, and whether or not to disclose your mental health condition when you get a job. So it's really by young adults for young adults is how we frame the show.
Within individuals who have lived experience with mental health conditions, there are a variety of subgroups within that population. It's really important to engage them, particularly in research. Some of our work engages young mothers who are experiencing a mental health condition around the time of the birth of their child. We also engage individuals who are deaf.
What we're hoping is that by engaging deaf people in the development of their own services and of their own research, they're not only the subjects or participants, that there are co-leaders and our leaders. We hired 4 deaf community advisors. They're not an outside advisory group that we check in with. They're here every week, and they are active members of the research team.
It's important to have deaf people and people from the community involved because research is usually being run by hearing people, people who aren't deaf, who are defining research based on their own experience, based on what they might like to know, versus fully understanding what deafness means and the experience of deaf people, and that's why it's important to involve them. What will happen when deaf people are included and when those changes are made is that deaf people will be open to getting help and being involved. They'll be more willing, they'll have more trust. They'll trust the people that are providing services, because that's not been the case in the past.
There's an expression called "nothing about us without us." If you are interested in the impact of particular services or particular research methodologies to a particular population, you have to ask them.
I don't think it makes sense to make any type of service without asking the people that are going to access those services, especially in the mental health community where recovery can look so different for so many different people. We need to be talking to people who have experience, really understand what that should look like.
It's their engagement that allows us to make sure that it's relevant to their lives, that it hits the target so that our research has better impact on policies and interventions that affect their lives.